Medication may help smokers who are unwilling to quit cold turkey gradually kick the habit. Researchers assigned more than 1,500 smokers to 6 months of the nicotine addiction drug Chantix, or a placebo. The Chantix group significantly reduced the number of cigarettes smoked over time and had higher quit rates 1 year later than the placebo group. Experts say this method may attract people who cannot quit immediately and help them cut down more gradually. There have been 141 cases of the measles reported between the first of the year through February 13th. That latest number comes from the Centers for Disease Control and Prevention. It doesn't include one confirmed case in Georgia, which brings the number of affected states to 18. The CDC says 80% of the cases can be linked to the outbreak that began in Disneyland in California. A professor is taking his unique research to the next level. Professor Charles Taylor started an artificial heart lab a year ago, and now his work will be presented on the big stage. Lauren McCoy has details on what he's doing and how it can help save lives.
It beats, it pumps, it keeps you alive. But what if your heart stopped working? That's where artificial ones come in.
One of the greater questions that the community is faced with right now is the designs are getting more complex, but the ability to test and verify them has not really progressed at the same rate.
Assistant Professor of Mechanical Engineering Charles Taylor is trying to change that. He says the way artificial hearts get tested now is too outdated.
I was surprised to see the amount of development with the devices, but not with the safety and performance testing.
Taylor is gearing up to present research from this lab to the FDA. He wants to make heart devices safer, but more importantly, he wants them to be more adaptable to each individual patient.
Some of these devices still are not adequate, in providing a level of care and supporting the types of activities that people look to return to after receiving these therapies.
Taylor couldn't go into much detail about the specific research they're conducting, but in general, they're using these models to help find ways to lower the malfunction rate of heart devices.
So we're able to actually take patient data, either from ultrasound data or from MRI data, create computer models of it, and then we're able to actually print the molds to cast silicone compliant models.
Taylor brought this artificial heart lab here to the University of Louisiana in Lafayette just a year ago, and he thinks it's already made an impact.
The biomedical research that we're achieving here really has an impact on the quality of care and the life outcomes of individuals in this region.
Dr. Taylor and his team will present their research this May in Washington, D.C. Still to come tonight, another look at that bitterly cold forecast.